So I am delighted today to talk about things you should think about. So your methodological considerations for translating survey instruments. And very interestingly, I got inspired about this topic by a Thai doctoral student who had worked with a professor in my doctoral program at Yale University over 20 years ago. And so you will see I reference her paper, which has served as a core methods reference for much of my work. So I was very happy about that. So just for some background, I when we're talking about researching and language, there are a lot of common things that happen. But I got interested in this topic because I was going to be doing dissertation research in Mexico. And like many doctoral students, I was trying to decide, do I do a survey? Do I do qualitative? Which way do I go? So the issue, and importantly, while I speak Spanish fluently, my dissertation chair did not. So she really wanted assurances that anything involving translation, whether I did qualitative or quantitative, was going to be rigorous and it would be conceptually equivalent. So I ultimately concluded that my dissertation was going to be qualitative, which is fine. And I had only one Spanish speaker on my dissertation committee. But this gave me a good methods foundation for exploring all of the literature about translation in research and how do we manage this. And this was not something people were really paying attention to too much back in the early 2000s when I was doing my PhD. So then I did a postdoctoral fellowship at the Center for Health Outcomes and Policy Research at the University of Pennsylvania with Dr. Linda Aiken. And I'm sure many of you know her work around staffing and nurse to patient ratios. So when I was a postdoctoral fellow, she invited me to be part of the RN forecast study. So this was going to be, at the time, the largest study of the nursing workforce ever done in the world. And it involved 12 European countries and China. And so with 12 European countries and China, there were 11 languages involved in the study. And no one budgeted any money for translation. So if you are doing a big multinational study, the single biggest threat to the quality of your data is going to be a bad translation. And we actually found some bad translations in one of the early part of the research. So from there, I have been using the same approach that I developed during RN Forecast for survey instrument translation with another 6 instruments and added, I think, 8 additional languages to that. But that expertise has also led me to being able to conduct multi-country studies through the consortium that I started, which we have 87 countries and counting. And we did a study during COVID in 27 languages where we wanted to make sure we were capturing nurses' experiences working during the COVID-19 pandemic. And we were specifically interested in countries that didn't have good research output. So China was doing lots of research. Nurses in China, not a problem. They have it covered. So, and the US, same thing, many European countries. So our interest was, let us focus on countries where we have to build and grow. And even this map is not the most up to date, but it was what I could find in my files. So all of these things have led to this expertise in cross-language research methods. So let's talk about why translation matters. So this is an example from Mexican Spanish. So I asked a friend, I said, give me the most slang-filled sentence you can possibly think of that would be really difficult to translate. So by the top bullet point, it says, oye, güey, este carnal es medio silvestre, déjalo y hacemos algo más chipocludo. So, okay, great. There we go. So the literal translation is listen way. So way doesn't actually translate into English. This carnal man is medium wild. So this is why you can't do a literal translation because it doesn't make sense when you do a literal translation. And it said, leave him and we will do something else more chipocludo. So chipocludo is 100% Mexican Spanish slang. If I use that word with other Spanish speakers from Latin America, they don't understand what I'm saying either. So that brings up the issue of amongst commonly spoken languages, there are regional or country level variations. So it happens with Spanish, with Arabic, with Russian. I imagine that it happens with differences in northern China versus southern China, different dialects, etc. I know Thai colleagues have also been telling me about the differences from the north to the south with the language and regions. So when we think about a likely translation of that sentence, it becomes, look, man, this idiot is completely off base. So silvestre is a way of saying somebody's a little crazy and wild. Maybe not that smart, not someone you can count on. And let him be, and we'll do something way cooler and better. And that was the best way that I could translate chipocludo. And I verified, because I'm not a native speaker, I made sure to verify this translation with my colleague from Mexico. And I'm like, does this get to the essence of what the person was trying to say? And he's like, yeah, it's like, it's a good enough translation. And so that's also important because you need a native speaker to verify what's the actual concept. Does it match up conceptually? Because some concepts don't exist in other cultures and they don't translate well. And so this becomes very interesting when we're trying to measure things with surveys, right? So the other thing is, if you're thinking about translation, so I'm curious, how would you all translate I'm at the end of my rope? This is an actual question from an actual survey. I'll tell you which one afterwards. Whichever languages you speak. Sure. How would you translate that?
So, we might inform the first person who are the experts in the world language. So, we involve to it.
Mm-hmm.
And probably we do the cognitive interview to explore the meaning of the.
Let's not even go that far. How would you just translate that right now?
So, dictionary, easy.
Does that work? Would you guys agree? So we have some yes, we have some no.
So you need to translate by our language.
Yes, translate into Thai, from English into Thai. We'll talk about AI. So this is a terrible survey question for a lot of reasons. First, it is even the English, people do not use it anymore. And in particular, this is a survey that asks people about their mental health and burnout. And so, do you really want to give people an image of I'm at the end of my rope, meaning I'm, ready to commit suicide? Not good. And for some populations in the US, being at the end of a rope is a reference to being lynched, taken by a mob and killed by hanging. So also not a good question. But most importantly, it's a slang phrase that was common when the instrument was developed, but we don't really use it now in present day English. So when the instrument was developed, the trouble is you develop an instrument and then it stays static. People don't update it a lot of the time. So because of that, it's a problem. Do you know what instrument this comes from? The Maslach burnout inventory. So this is the most common measure of nurse burnout in the world and healthcare provider burnout. Yet this was one of the original questions. So that's a really important thing to think about when you're developing a new instrument or when you're looking at a translation is, does this language make sense to translate? So there were 7 questions on the Maslach burnout inventory that we identified in the RN forecast study that were highly problematic for translation. And so because they were highly problematic, we concluded that, we would keep an eye on these responses to really see were they valid. And many of the researchers actually in the end threw them out because the answers didn't make sense because they didn't translate well. So the next thing is, so say you have a Likert scale. How do you look at what's the difference in your culture between fair and poor? And people online, feel free to type in the chat if you have questions or want to contribute to the discussion. So what's the difference between fair and poor? Would you agree? Oh, don't forget your mics for the online folks. Sorry, I should have reminded.
I agree with Arjan. I think that it depends on as the participant to read about the item about in the instrument, that it depends on the meaning they understand, that interpret the poor or fair in each item, right? Thank you.
But how much room do you have on your survey to explain what you were trying to measure in terms of the difference between fair and poor? So, go ahead.
So you mean before we shouldn't have like clear instructions, it's about how to rate. And I think the quantitative research method cannot address the inside, the meaningful, and then we can have like next phase about qualitative research on how to expand the meaning and like the concept of fair and poor.
Right.
Yeah.
Or do you just pick a different Likert scale? Do you think about using something that's clearer, less ambiguous? So in many of the languages that I've worked in, people have said, we don't have a difference between fair and poor. It's pretty much the same. So when you're working with someone in another language, it's helping to figure out, well, is that the right way to measure? So then we get into something like for health services research, how do we differentiate roles by country? So if we talk about a hospital director or a nursing director, what does that mean? Sure. So if you are thinking about the title of a nursing director, what does that mean?
Translate, right? Translate the specific role of directors, or it still be in fair poor performance. So if from my under perspective, I think that the directors can be like the top and takes more responsibility in order to be poor and fair or excellent. We need to have like job descriptions, and we have to have like the meaning or the scale evaluations of their role and responsibility. So I think, yeah.
So in RN forecast, a nursing director could mean the chief nurse of the country, the chief nurse of the Ministry of Health, the chief nurse of the nursing division within the Ministry of Health, the director of the hospital or healthcare organization, the ward level manager, or the nursing director for big hospitals over, say, oncology services. So when we think about roles, we have to think about what is the equivalent role that we're asking about across countries or health systems, even healthcare organizations. You know, what between different hospitals, you might have different titles. Now, if it's a public hospital system, you know, where the government is funding it, the titles, the names, they tend to be standardized. But if you have different options for healthcare delivery, they may be different. So if you are partnering with people across countries, these are important things to have conversations about. Another good one is supervisor, the nursing supervisor. Who do we mean by that?
I can be consider myself a clinical supervisor for nursing students. It's
Mhm.
depend on context and organizations. Yeah.
Yep. So that's one.
In my hospital, it's quite different from your list. It's like a top-down hierarchy, I think. But in my hospital, it's different because the supervisor have more authority than head nurse.
Uh-huh.
I think so. It's based on the contextual
Mhm.
of each hospital or settings.
Yeah.
Yeah.
Well, I didn't list this in a hierarchical order. This was just sort of what came to mind when I was doing this. But a supervisor sometimes is the shift supervisor, the ward supervisor, you know, could be anything. So when you're thinking about different roles across different hospitals or healthcare systems, you really have to make sure that they're equivalent. So one of the things that came up consistently in RN forecast was the role of the chief nursing officer, which is a term that is used in the US to refer to the chief nurse of the entire hospital or health system. And if it's a health system, there could be the chief nursing officer of the whole health system, but then the chief nursing officer of one of the hospitals in, say, like a 5-hospital system. So they actually have thrown that question out of the practice environment scale of the nursing work index because it was too difficult to measure across hospitals and health systems. So, come on. Advance. There we go. So again, our Likert scale. So tell me, it's time, there's a word for never, right? There's a word for always. Is there a difference between sometimes and often? Hmm. I know you don't think about these things, right?
I think maybe we can have like the scale of 100%. Always it mean over 80% on every time. But for often it can classify by instruction like 60 to 70%. It
Mhm.
depends on maybe you can perform this activity at least one or something or every time like more than 5 times a week, something like that.
Yeah. So one strategy is quantify the difference in terms of a frequency of performance, if that's appropriate to your question. But conceptually, what's the difference in your language between sometimes and often?
In my opinion, I think it's ambiguous between sometimes and often because two persons can view the word sometimes and often so differently.
Mm-hmm.
In my view, sometimes for me it's mean 3 or 4 times a week, but for my friend it will kind of different. Mhm.
Mm-hmm. So I have actually stopped using this type of Likert scale when I build instruments because it was too ambiguous. And in my latest project where we were developing new instruments, we were doing cognitive interviewing. And what we found from our participants was they didn't like this either. It was too ambiguous in the middle. So it's an interesting thing to think about, but I encourage you when you're looking at Likert scales, even in existing instruments, ask yourself, and ask your participants who are evaluating your instrument, does this measurement make sense? And you can justify changing it because you can say that scale did not make sense for this context. Perfectly okay. So another thing to think about is that your symptom language is probably going to translate more easily than systems language. But there will be cases where a language may not have a word for a phenomenon. So my country partner from the GCNMS from Cambodia, he told me, he's like, well, we didn't have a word for depression in Khmer. I know, right? So because they didn't have a word, how do you measure that? Then you have to measure it by symptom, And so one of the things when you're doing something in another language is you have to have that native speaking partner and you need to determine, do those words exist? This is very, very common actually for mental health phenomenon because there is often a lot of stigma around mental health. So people don't use those types of terms to talk about a mental health issue. So yeah, when measuring, you have to learn how do people talk about the phenomenon they're experiencing in order to measure it precisely or as precise as we can. Another interesting one is translating the conceptual meaning of something. So say you're completing a survey and it's asking you, do you lack supplies to do your work as a nurse? So what does lack of supplies mean to you?
เธอเอาก่อนใช่ไหม
Me too.
Okay. First, this what lack of supply in my view. I think that it's nothing to surprise in the for example I do the research with the caregiver. I think it mean the lack of supply for the caregiver about they don't have nothing support by the healthcare provider. This is the meaning of them that interpret that lack of supply. Nothing to support, such as the support about the information, support about the equipment, something like that.
Yep.
Yep.
What else? Other interpretations?
What else?
In my for me, I think the lack of supplies means the limited of resources. Yeah, as a nurse, we give some resource to patient, but it will limit in like the mass casualty incidents or disaster event or something like that. Mhm.
Other thoughts?
Yeah, I agree with this. But I think if I focus on the nurses, some supplies like the time, the skills, the training are all the supplies, but also both from the resources, limited resources. Yeah.
Okay. So there was a question in RN forecast that asked nurses, do you have enough supplies? It was phrased about basically, do you have enough supplies, referring to your shift? And so in some countries, but it was like, well, what does that mean though? Lack of supplies. Is it, oh, we ran out of something on a shift, but it will be replaced on the same shift? Or we ran out on one shift, but they'll fill it in the next shift. But then I did qualitative work with nurses in Mexico, and they talked about, especially in the public hospital, they talked about running out of supplies, and they didn't come back, they didn't get them refilled for a week. And some other nurses that I've worked with in very low income countries, they're like, well, if we get it in a month, that'll be good. So it's that aspect of when you ask, do you have enough supplies? Maybe you need to understand, well, what does that mean? This month? Or you need to add a time-bound measure to figure out, did you have that? Did you have what you needed to deliver the care to the patients you were caring for? But as you saw, everybody, based on their type of research or interests, had different explanations. So context is very important. So when our current state of research, there are a lot of survey instruments that have been out there, especially in nursing. They've been developed in English-speaking, westernized countries. Some of them are 30, 40 years old. And, they reflect the language of the time. And, one thing we know is language evolves over time. And so if language evolves, then we need to make sure that the language being used reflects current phraseology. So if you think about some of the terms that your grandparents use, that you just don't use. Or if you have teenagers, I'm sure you are told you are so old because you use this phrase, which is just for old people, right? Yes. Such a joy, those teenagers. And so when we look at existing translations of instruments, a lot of them were done very badly. I had an experience where I was doing data collection and a colleague was using an instrument. And, I looked at it and I was like, I don't think that means what they think it means. And the patient said, I don't understand what you're asking, because as it turned out, when I went back to the original instrument, the translation was really badly done. And so I had to go to my colleague and I said, you shouldn't use this because you're going to get bad data. She's like, but it's been validated. And I'm like, no, actually, what you will see often is the instrument is just translated, but there were no psychometric analyses done to determine its reliability and validity. So if you're looking for the instrument, you need to find it. And there are some instruments also that your reliable and valid translation you have to pay for. Very annoying. I think that's wrong, especially in this day and age. So instruments that I develop, I make publicly available because I think that's important. So the other thing is if you're taking an instrument developed in one country and trying to use it in another country, then it's really important to do a contextual assessment. Like, do these questions make sense to ask here? And you are the context expert. Have confidence in that. And so you need to figure out, and it's you doing the initial work, but it's also your expert colleagues or patients who are also helping you to determine, does this apply here? So reducing bias and threats in translation. So my fellow student, Meyers, did I get that right? I've spent years trying to practice pronouncing that name. But she figured out with my survey research methods teacher, Dr. Dixon, she figured out that forward and backward translation weren't enough, actually, to produce a good translation, and really advocated for adopting a much more systematic approach. And this must have been on people's minds at the time, because there was a cluster of articles that actually came out about this. So the idea is that, if you're going to do a good translation, you need multiple sources of expertise. And obviously you need native speakers involved. And you also have to think about what other problems might arise from doing the translation and testing the measure. And translation is always a limitation in any study. So if it's the first time that you are using an instrument and its translation, then you just acknowledge that it's fine. There's a first time for everything. And really importantly, translator qualifications. Now, this website reference that is on the slide is one option, but there are many international interpreting groups out there that you can work with. So translators are actually, people tend to use translators for everything, but the translator is somebody who translates a document or your survey instrument. An interpreter is the person who's doing the live action interpreting. So that's the person you might have involved in your qualitative research study. And ideally, they have an advanced degree or advanced training in interpretation and translation, or some sort of certificate. That's your ideal situation. But we don't always have that option. It is very common for professors to rely on native speaking graduate students to do their interpretation for them, or their translation, if they want to do, include a group from that, from the language that they speak in their study. And, that can work, but it really helps if somebody actually understands the mechanics and how do you produce a good translation. So, for a lot of things, a bachelor's degree and some experience working as a translator can also be useful, because not all groups are going to be highly educated, but you may have people who have naturally become and worked in interpretation and translation. And if they don't really have a bachelor's degree, for research purposes, it's different if you're actually in the bedside healthcare interpreting. At least 5 years of work as an interpreter or translator. These are just general guidelines. And sometimes you do just have to work with what you have, especially if you don't have a lot of money to spend. Because interpreters and translators, good ones, can be expensive. So when you're working with an interpreter or a translator, there are a couple of differences that may arise that are going to affect your data collection, or how the translation is done. So if you have an interpreter who's from the same country and language group, but a different social class, and you're using them to help you collect data, that may affect the interaction that they have with the person you're collecting data from. Their education level, like, are they good at speaking at the same level of the person you're interested in recruiting for your research? Or do they speak at a very high level and you have a disconnect? That'll be a problem for data collection. People's migration experiences will also affect their data collection in terms of what they may think is important. So it's really important for you to understand where are they coming from, their migration experience, but then also how much training you might need to do. And then different ethnic groups. These may arise, you have no idea, and you thought, oh, I'm collecting data from X group. And this happened to a colleague of mine. She was collecting data from Chinese immigrants, and she had an interpreter. And so, and she, the experienced interpreter, really good reputation, all that kind of thing. So the interpreter was going and collecting data, and the interpreter happened to speak, one of the dialects that was not commonly spoken as much anymore, but was good that way. And then it turned out that one of the people that he was collecting data from came from the same village that was a rival village from each other's ancestors. And this caused a huge uproar during the data collection and it was a very, for both the researcher and the interpreter was a disturbing experience because, how can you anticipate that? Right? But it's thinking about those things, especially when you're working with immigrant groups or older adults who migrated. There may be things that go so far back in history that you are not aware of, but they may come up. It's one of those things you can think about planning for, but maybe can't always anticipate. And I've heard similar stories from Arabic speakers, Spanish speakers, indigenous language speakers. It's not unique to one country. It can happen anywhere. Oh, especially in the Balkans and Europe, like there's a long history of like villages being like millennia of rivalry. So this is why it's really important to know your sample and who you're collecting data from. So if we're thinking about any study that's going to require you to have a translated instrument is probably going to involve cross-cultural research. So this is either you are collecting data from a group that you are not from, or you are trying to adapt an instrument that was created in one place for use in your country. And how you go about that just depends on the intent of your study. Are you using existing data? Are you creating a new instrument? Are you doing an adaptation of an existing instrument? Really just depends on your intention. And we can get into the weeds about that if you like, but we can do that at another time. So if we're thinking about your survey instrument translation, a good study, if you are doing a critical appraisal of a study that involved translation, you should see that there was an expert panel review of the instrument. There definitely was forward and backward translation by qualified translators. And that the overall approach really should be grounded in cross-cultural research methods. That's when I was first doing that was sort of new and everything. It's now really become standard. Like everybody acknowledges that's essential. And it really helps to show that you have some way to quantify your pre-data collection evaluation. And so I am a big fan of combining content validation with cognitive interviewing, which we'll talk about in a little bit. So when you are doing cross-cultural instrument adaptation, and I think, it moved onto the screen there. So you have 5 areas of equivalence: content, semantic, technical, criterion, and conceptual. So for your interpreter, the semantic, technical, and conceptual are the most important. For measurement, content and criterion are most important. So this is why working with an interpreter or a translator is really important when we're talking about producing a reliable and valid translation. And these standards have been around for a very long time, so nothing new here. So when I did the RN forecast study, and this graphic will pop up, there we go. So we had 12 countries, 11 languages, and we had to have everybody do it the same way. And they gave me no money. It's like, oh, good, this is your postdoctoral training project. I was like, okay. $3 million study and nobody budgeted for translation. Okay. I'm like, the Americans shouldn't be the one pointing this out, folks. You know, but so what we did was we had every team go through the instrument, which had already been finalized. And then what we did is the country teams would then do the forward and back translation and come back. And then we verified the translation that everything matched up and that nobody forgot to translate translate an item because it was a very long survey. And so then the country teams had to recruit expert raters. And so they were able to complete the CVI process. Some of them did it on paper, some of them did it online. Doesn't really matter. Either way works. For some people, doing it online, setting it up online can be kind of challenging. I will tell you, but so sometimes paper works. And then we said recruit between 5 and 10 raters per country. 5 was generally the recommended minimum for content validation, for scoring, because, you know, it helped you needed, everybody had to agree. Basically, you couldn't have variation. Up to 10, you can have some variation. Once you get past 10, the numbers don't change in any way that's meaningful. So you really don't need more than 10. And so I got all of the scores back, and I spent probably a week trying to figure out how to program the formulas into Excel with a modified kappa calculation, and eventually had to call my cousin, who was a math major and knew how to do that in Excel. I was like, I should have just called you from the beginning. And so to this day, I have saved the template that is pre-programmed so I can always I never have to reprogram the template. And so then we ended up with our finalized survey. So this was how we did our pre-data collection evaluation, so that we could say, this is where we were able to identify items that were potentially problematic, where there were issues around health system differences or cultural differences around health concepts. And is everyone familiar with content validity indexing? Yeah. Okay, great. That helps a lot. So as you know, this is used to evaluate questions for inclusion into a new instrument, but I applied this for doing it with an existing instrument when we were doing translation. And so the expert raters, really for us, for this study needed to be a nurse who had recently worked in a hospital setting, because that is where our measurement site was. And it didn't need to be somebody who had research experience or a graduate degree or anything, because the people completing the survey were the experts. So I wanted to make sure it made sense to them. And this is important with patients too, because patients are your experts. And I have a colleague who took this process and applied it to head and neck cancer patients to develop a symptom measure. And she said it was one of the best things that she ever did. It was really, really valuable. And she has a very good quality instrument right now. And so one of the things with content validation is it doesn't correct for chance agreement. Now, Pollitt, Beck, and Owen said that, we don't think you really need to do a modified kappa calculation to show chance agreement or capture agreement, because the CVI should be enough. But what I found with the kappa calculation was it was a more precise measure around item quality than CVI. But it's still important to do both, because when you have a borderline item or something that looks like maybe this won't work, it's still important to test it and figure it out. Or it may be a signal that when you collect the data, that you're going to get some weird findings. So this is an example of how content validation works. And so these were 2 questions from the practice environment scale, and these were sample ratings. So the 1, 2, 3, 4 is the content validation. And then we just simply asked the expert, is this translation correct or not? Because we didn't think that there should be a partial correct on the translation. That was too much of a nightmare. So it either was or it was not. And if it was not, then it needed to be changed and corrected. And then the rater had the opportunity to fill in comments. Nurses have opinions. I don't know if you've observed that. Yeah. Uh, but they made some very good comments in many cases about the structure and phrasing of the survey item. So this is really interesting. So this is an example. So we had some common languages, but different countries that were in the RN forecast study. So what's interesting is, in Belgium, they speak Dutch and they speak French. Now, fascinatingly, if you look at their CVI scores, the Dutch was within the acceptable range with CVI, is 0.8 or higher, but the French was not, even though they said the translation was okay. That was interesting. So you see the translation, yeah, pretty much okay, not really different, but the French speakers had a much wider range around their CVI scores in terms of overall scoring numbers. Now, interestingly, it was much closer to the Swiss French in terms of scoring. So the Belgian French and the Swiss French, you'll see it's a 1/10 of a point difference, effectively no difference. And not too dissimilar on the translation scale. And the Dutch, the Belgian Dutch, and the Netherlands Dutch, almost identical, right? And then you look at German. So you have Swiss German and then Germany German. Big differences there, and within one language. And again, much wider range on the German one. And so when we actually looked at the original German translation, and it turned out there were a couple of errors. And they had already done a big study with the German translation. Uh-oh. So that was awkward. I'm a postdoc. I get to point that out to, Dr. Aiken, and everybody say, but guys, no, I was actually an assistant professor, but still very, not tenured, trying to do my job, and pointing out that their big study had a major flaw in the findings because of the bad translation. But it was a good thing to find, actually, because it reinforced the importance of translation, especially to Dr. Aiken, who originally was like, oh yeah, we'll just translate it literally. It'll be fine. I'm like, no. So one of the translation errors was, one of the questions was, do you have enough dressing supplies? And the original German translation translated that is, do you have enough supplies to help patients get dressed, as in put on their clothes? Big difference. So this is where finding these problems becomes really important, and making sure that they're checked beforehand is also done. So again, we did this with Spanish in the Americas. And as you can see, there was, for relevance scores, there were big differences between Mexico and Central American scores and South American scores. And that was really interesting in terms of accounting for, that's where the system language came into play much more prominently in the instrument. So that was an important capture in terms of understanding the additionally differences between the same language. So cognitive interviews, this I became a fan of when I was working with colleagues from the Czech Republic doing this same process, because they were going to do their own replicate the RN forecast approach. And so they brought me over and they said, well, we're going to do the CVI process, but we want to discuss in a group and we would like you to facilitate. And so that was what I did. So I went over and we did this whole exercise, and I had an interpreter. But it was fascinating looking at which questions provoked conversation, but that was how they did consensus, was they went through and they asked everybody for their rating, and then there would be questions that provoked conversation. So this planted the seed for another way to do this, to combine the content validation, which for the pure positivists makes them feel good about the translation quality. But the cognitive interviewing helps us understand where do we might see additional issues around semantic or technical or conceptual translation issues. So, and oh, I totally did not finish spelling forthcoming there on that. But I have a new methods paper that will be coming out this year on this methodology that we used for my most recent study, where we wanted to make sure the instruments we were developing to look at hospital nurses and their practices around navigating language barriers between patients and themselves, we wanted to make sure it would apply across specialties. So, you know, emergency department, ICU, obstetrics, medical surgical, all of the different practice places for nurses, because we know that ED emergency nurses and ICU nurses are very keen to tell you it's the extensive differences between their practice places, right? Happens everywhere. And also with different populations, like a pediatric population or a neonatal population, those kinds of things. So it's an important, it was a really useful exercise. And we had 50 raters, each 10 from each specialty group, do the rating process, but only about 20 ended up doing the cognitive interviewing just because of scheduling, but still incredibly useful exercise. So when that paper comes out, I will make sure that it is shared with you all. So, AI and translation. I have a few thoughts. So, I don't know what happened during the COVID pandemic, but all of a sudden, the Microsoft Word translation function got so much better. So, as a fluent Spanish speaker, I can also write and publish in Spanish. And I never bothered with the word translation function because it was so bad before then. And it wasn't worth my time. It took me more time to correct the errors than it did for me to write myself. And, you know, for me to have, you know, up on one monitor screen, the English, and then type and translate my own work into Spanish. So, but then that happened, and I had translated a document. I didn't have time, so I just thought, oh, I'll check this out. And then I looked at the translation. I was like, that looks pretty good. So I sent it to my native speaking colleague. I'm like, this is pretty good. This seems pretty good. Am I imagining this? And she's like, no, it's actually really good. So then I tested it out in Arabic, sent it to my graduate assistant who speaks Arabic. And I was like, how's the translation? She's like, actually, it's really good. I only needed to correct just a couple of things. I was like, oh, this is a game changer. This was one of the things where I was like, oh, now we can actually take this and do this, translate our instrument into 27 languages. But that worked for all of the United Nations languages. But when we had Somali or Slovenian or Swahili, languages that basically there's not as large a market as there should be for your computer products, or Khmer from Cambodia, the translations were terrible. The machine translation did not work at all. So that's a big problem. So those teams had to spend more time doing the translation in the traditional way. So yes, it can speed up the process. It saved us a fortune in translation costs. And if you use an online survey tool like Qualtrics just does the translation. It says it'll do it and it'll translate it for you. But you still need people to check it, because sometimes, again, healthcare language doesn't always translate. So that's a problem. So anything that involves really technical language, you really need to be double check. If you ask an AI function a system to do a translation for you, do a forward and a backward, and you feed it back its own, it will not produce the same text that you fed it. It often radically changes the meaning. And this has been based on who has been feeding the AI. Yeah. And if it's mostly men feeding the AI, men and women have different language and phraseology. So it converts, it changes the voice. And that becomes potentially problematic. And I think, I think that eventually there'll be protocols for how to use best practices for how to use AI in translation. But, I think we need to do more testing. That's one of my ongoing projects is because with all of this data that we have for our COVID study from the consortium, we have 14,000 data points in 27 languages from nurses in 103 countries. My teams are not doing all that translation by themselves. So it's helpful in terms of being able to get the gist. Do we get the most accurate? Not always. So you have to keep that in mind. AI doesn't really do slang words because, the slang words that you're using in everyday speech aren't necessarily what you're plugging into AI, right? But it does save costs. So my conclusion with AI is test it out, be systematic, but always have a human check. But paying a human to check it for 2 hours is a lot cheaper than paying a human to do a full translation, which could take 40 to 60 hours. So that's it's evolving, and I think it's just something to keep in mind. So when you are, hopefully this lecture has impressed upon you that if you're going to do a study involving language translation, make sure you are planning carefully for methodologically, but also budgeting appropriately. I review grants and people don't budget for translation. They think the AI will just do it and it'll be cheap and it'll be accurate. And it's like, language translation is always going to be a study limitation. So that's something that just keep in mind, acknowledge that when you're writing up your results. And don't forget, if you have the word count, whenever possible, try and talk about your translator because they are a part of your research. And their identity matters as much as your identity matters. And this becomes more important with qualitative research. Please come to my lecture tomorrow morning about qualitative, cross-language qualitative research. But the more systematic you are in terms of your translation approach, the more you're going to increase the rigor of the translation process and thus the rigor of your study. So you're going to reduce the threats to validity that are going to arise from language translation. And I know you're going to have a copy of this presentation, but these are some of the core methods papers that I have used over the years and also to build this talk. And all the DOIs are in there, so you should be able to access them. But as you'll see, they're not all from nursing journals. I think it's really important to draw from journals that involve interdisciplinary research methods. So keep that in mind. And if you're too shy to ask a question now and you want to ask one later, please feel free to email me. And I'll be happy to talk about your methods question or anything else you want to talk about. Questions?
May I have a question about translating process?
Mm-hmm.
Because you mentioned it's about backward translations.
Mm-hmm.
So in my PhD thesis is about qualitative research. So the process is we start interview in Northern dialect
Mm-hmm.
and translate into Thai.
Mhm.
and then translate into English because we
Oh.
have to,
Yeah.
Yep.
That's a tricky one because you've got a triple translation.
Yep.
And I'm guessing that the Northern Thai dialect doesn't translate directly into English, or
Yes, but some
it's easier.
I'm just thinking because, as a PhD student, I couldn't jump from the Northern dialect to English because of we want to show the process transparency, how to translate. And luckily, I just asked Dr. On Anong,
Yeah.
yes, to be expert because she in French, in Thai, in English.
Mhm.
She can be like my third to review, even like the first process of review my focused interview guides topic. So in terms of translations, so my question is there any clear step or frameworks that I, as a researcher or like novice researcher, have to make sure that I follow the framework, the step of translations to make sure that when I want to publish internationally, it means to reveal the transparency into my translating process.
So, one way that you can do that with qualitative research is when you are presenting your quotes, you can put them in a table and you can present the original language and then the translation in your language and then the translation into, say, English. And that way, if you have people that speak it, they can look and evaluate and say, like, oh, yeah, that was good translation. I mean, as an English speaker, I'm going to read it. I'm like, oh, those are really interesting quotes. Couldn't tell you what the other stuff was. But, it's the important thing is if somebody from your country read it, would they consider it valid in terms of the translation? And the main thing is as long as you are clear about the methods choices you have made and you have explained that when you are writing the article, then that helps with the rigor. And they're all choices, right? There's no such thing as a perfect study. We just have to explain our choices.
So in terms of methodology, it's grounded theories. That's I just try to justify because Northern dialect is still grounded and voice into the participant voice. That's why I think like it's very too many steps translate from dialect to official Thai and then English. But this is my justification and suggested by my supervisors that it should be in contextual and their own voice.
Yeah. Absolutely. And I think, especially with qualitative research, presenting the results in the participant's voice is really important. If I can manage to, I'm going to see if I can bring up. So, my consortium, we published a study in the Journal of Advanced Nursing. Oh, I just noticed Thai keyboard. How cool. Here we are. Let me tell you, selling people that this was a qualitative study, that was a project. So this was our pilot test for our multi-country approach to our study. And, oh, sorry. Yes, I will share the other one. Here we go. It was good. You didn't need to see me searching. So let's get that up there. Okay. So when we presented the results, it was really important to me and to our team members. Here and in here. As you see, we have lots of tables. Here we go. So this was our table 5. So there was no way we could put all of the quotes as exemplars into the paper because it would be a really, really long paper. So we had, here are some of the quotes. So we had Spanish speakers. So everybody could see the quotes as they went through each one, but then we had the translations on the side. And so you see, we had Hebrew speakers, we had Korean, again, Spanish, we had Mongolia, which is used as a Cyrillic script. We had Polish, and we had Saudi Arabia. Now, Saudi Arabia being interesting because we had Arabic speakers who responded in Arabic, but so many nurses come from other countries, so a lot of them responded in English. And so we did that all the way through with every theme so we could show the persistence across countries with exemplars from each language. We didn't want to rely just on one language as an exemplar because we really wanted to show how these themes persisted across all nurses' experiences in different parts of the world, very different parts of the world sometimes. And, not every country, every language had an example in every theme because, sometimes people would just write a short quote in response. Sometimes they would write a beautiful quote. So that's, but that's typical of doing qualitative research. But Thailand hadn't joined the study yet. But that was shortly after we finished this, Dr. Apiridi wrote me and she's like, I'm coming to New York. And I was like, hello, would you like to join our consortium for Thailand? And so she did. And we are still collecting data. So if you go to the consortium website, you can and you worked during COVID, you can share your experiences. But this was one way to hold true and be transparent about the quality of translation. And hello, everyone there. Any questions? Any questions from online?
I have a question. I did the data collections by using the CBIs to measure the caregiver burdens of family caregiver of older adult with dementia in the neurological Chiang Mai hospitals and last couple of years. I used the CBI. It has been translated in Thai already. But I feel like in the practice, it's not capture the caregiver burden 100%.
Yeah.
Because I found several cultural factors influence the caregiver burdens, but Thai caregiver does not feel it is caregiver burden for them. It is just family obligations, this responsibility that they need to take care of the parents. So in these situations, and you mentioned that the type of equivalence, I feel like, oh, it's very interesting. And in this situation, how do we know in the next step?
So it's good. So you tested the instrument and the translation, and it worked sort of, but you found it missing some aspects that were important. So what you could do is you could develop additional items that should be added to the instrument for use with Thai populations. And it's useful in general because there are Thai people all over the world, right? Thank goodness, because I got to get good Thai food when I go home after this 2 weeks. Yeah. So it's useful to have those instruments available in languages, in good translations, but also with questions that will be culturally specific. So you can do the Thai adaptation 2 of that instrument as your next research step.
Thank you so much.
There we go. Yeah.
Actually, I don't have a question, but I would like to share from my work. Right now, I am on the process of developing the research instrument of my PhD research. Totally, I use 10 experts in the development of instrument. I divided for the two groups. The group one check the accuracy and adequate of the modify and translating of my research instrument and back translation, and then send to the native for check the semantic equivalence. And after that, I will gain the final of my instrument, and then the group 2 consists of the 6 experts to check the CBI. So I want all of you to suggest me about the appropriate or the chance to develop this process. Suggest about the pros and cons, or in your opinion, that adequate or not, or yeah. It's good to
It seems like you've got a good start. Good, and good for you for developing a new survey instrument. We don't let our doctoral students do that because it takes too long. We have a question from online from Cherry. Hello, Cherry. So she asks, after she finishes the translation, do you need to do the confirmatory factor analysis, exploratory factor analysis of the translated instrument, and which one do you do first? Excellent question. So you want to make sure that with your instrument translation that you are doing a pilot test. And with your pilot test, you don't need to have a representative sample. You just need to have a test sample. So the pilot test is needs to be, your sample size is dictated by the number of items in your instrument. So if you have 25 items in your instrument, the minimum sample size, the rule is minimum of 3 participants per item. So your minimum sample size would be 75 participants, which is very doable for a pilot. The more you get, the more precise your factor analysis will be. The maximum number is 10 for a pilot, 10 participants per item for a pilot test. So if you have 25 items, then that's 250 participants. So depending on your prospective sampling pool, that could work, that could not work. And so once you have done that, you are going to redo the exploratory factor analysis first, because it's technically a new instrument, but you may want to compare the initial exploratory factor analysis with the original instrument's factor analysis. It is absolutely fine if your factors in your translation do not load the same way as the factors in the original. This was a point of methods discussion I had with Dr. Aiken, who thought that all of the factors had to load exactly the same way. And I was like, they don't have to load the same way because health systems are different. People's structures are different. That will change what loads where on factors if it's a health services instrument. If it's a symptom one, it might load the same way, but if it doesn't, it's probably not loading the same way due to cultural issues. And also, again, it's specific for the context. So it should load it could load the same way, it could load differently. That's fine. So you do the exploratory and then you can do the confirmatory once you've done the initial work. And principal component analysis is a very useful addition to that process.
I have a question. Because when I do my research, I choose an instrument, but this instrument has 3 sub skills. I want to choose 2 sub skills of this instrument. But one sub skill have a low reliability. But so now I'm wonder whether I should consider another sub skill or continue to choose this sub skill or it.
Well, one thing to think about is the low reliability. How did the original author explain the low reliability of the subscale? And one also wonders, why did they keep a low reliability subscale as part of their instrument? It's sort of
because this instrument oriented by European author and it have a very good reliability. But after the Chinese translation, one sub skill is very low. But this sub skill still used in my situations by others. So
that's interesting. Did the Chinese translation explain why they thought the one subscale had a low reliability?
They just explain it and keep this subscale because according to the theory, so they keep this subscale, but others didn't explain about their reliability in the research. So and now I have a little anxiety about this situation. If I choose such a sub skill, maybe in the future my result will be bad.
So one of the things to look at is do some sleuth work. So how did the Chinese translation happen? You know, did they actually do forward and backward? You know, did they use AI? Like what was there may have been a methods issue in the translation process. And then you look at what other people did. Are they finding similar things, or did they just use the translation because it was there and they didn't question because it was published?
Yeah.
And so who cares? It's published, no problem. And so if you don't feel confident in the translation based on everything you see in the literature, do a new one.
Okay.
Yeah.
Thank you.
Because you can explain and justify the new one based on the issues that you saw. And, you know, part of a good literature review is critiquing what's already been done and pointing out, like, you know, there were these issues that came up and that were a concern.
Okay. Thank you.
Yeah.
I have one small question. It's about how to use the instrument, because we ask the patient or participant to complete it for self-report. And some, I don't know how the collecting data processed. They may ask someone who self-report or open-ended and like collecting data by the researchers. I think it's two method. It might have a lead different outcome.
So, I mean, anytime people are filling out a survey, there's going to be missing data. This is a sad fact of life. I mean, we actually have 23,000 engagements with our survey, but our usable sample is only 14,000. Still, for an online study, 60%, that's not bad. you know? So I think you just have to have a good plan for how you manage the missing data. But for the open-ended questions, now I have a colleague whose methods passion is analyzing orphaned survey comment data because he feels like people collect it and then they forget about it. And if you've done it, you can guiltily admit, yeah, I just ignored whatever people were saying in the comments, or, oh, I don't have time. So I have a colleague and I tackled this issue. She did a national survey of midwives in the US, and she had comments on specific topics that she wanted to also know more about. And about a third of her participants ended up leaving comments of different types at the end of the survey. And so it was about 1,000 participants who made at least one comment, but possibly two or three. So it was a really nice number of comments to analyze. And so it was interesting analyzing short comments qualitatively, because we were thinking like, well, when do we hit saturation? Normally you're doing an interview and that's when you're getting an idea of here's when we hit saturation. But with a survey, how do you know when you hit saturation? Like, is it when you're not getting any new codes? So coding saturation. So how many comments did we have to look at before we felt we hit coding saturation? And then how many comments did we analyze till we hit thematic saturation? So in this case, it was somewhere between 100 and 150 comments where we sort of hit coding saturation. No new codes were emerging during the analytic process. And we were probably about a third of the way through the data before we were feeling we hit thematic saturation. And this makes sense because, you would almost expect the thematic saturation to happen toward the end of analyzing, 1,000 comments. But because there were only 2 questions that they answered, we hit saturation much more quickly than we expected. We still analyzed every single one, but nonetheless, it was an interesting experience in terms of thinking about saturation when analyzing survey data. Now, probably this would be one use where I would use a closed AI system. So I don't believe in feeding AI research data of any kind and training their models for free. So a closed AI system is one that's not used to train their models. So my university has one. What I would probably do now is I would put all of that information into the AI in a file and say, can you summarize the common trends that you see? And it's just straight content analysis. AI can't do pretty much any other type of qualitative analysis except for content analysis. People think it can, but no. If you if you can play around with it, ask AI to do a qualitative analysis of an interview and ask it to do a descriptive analysis, and then ask it to do a content analysis, and like pick your method, a thematic analysis, exactly the same results every single time. No difference. It may get there, but you have to program the intention into the model in order to get an accurate analysis. It'll be available in the next 5 years. I have little doubt. For better, for worse, for all of us. All right. Anything else? All right. If nothing else, I will see if I can turn off the recording. Or maybe, oh no, somebody else turned it off already. Never mind. All right. Oh wait, nope, still recording. Oh, someone else has to turn it off. Okay, well, all done here. Very good. Thank you all. Very good discussion.